Hello, and welcome to Bioidentical Hormone Replacement Therapy, or better known as BHRT. This is part two of a two-part series, and will take approximately 20 minutes. I'm Nancy Lamb, a pharmacist with Good Day Pharmacy, who has served as a consultant pharmacist for over 35 years. We're going to start with hormone balance. That's what you're looking for, is a balance. More is not better. You need your hormones in balance to feel well. Stress can unbalance your hormones. It's often called the pregnenolone steal. It's when you're under stress, so you produce more cortisol, and you drive this orange pathway. It takes away from your progesterone and your estrogen, so you can't get your hormones in balance because this is constantly stealing it. So if it steals your pregnenolone, it doesn't work as a starting factor for your other hormones. So it's important to find your hormone balance. We're going to follow the green line. So first we're going to talk about progesterone. It's secreted during the luteal phase, which is the last phase of your menstrual cycle. Your menstrual cycle, day 1, is the first day of menstruation or the first day of your period, and all your hormones are low. If we follow this green line, which is our progesterone, we see here an ovulation is where we drop an egg. And when it's not fertilized, then it disintegrates and makes progesterone. So here's your progesterone. So when we measure progesterone, we want to measure it in day 19 to 21, so we can measure its peak, because that's what we care about. So you can see, if you're at a doctor's office and you measure your hormones anywhere else in this cycle, you don't know what it means. It needs to be measured day 19 to 21 if you're still cycling. What happens with progesterone is it's the first hormone to decline. When we're young, so 25 to 35, our estrogen and progesterone are in balance and remain somewhat consistent. Starting about 35, there's a significant reduction in your progesterone. That creates the first imbalance, and often that's when women first notice significant PMS. That's because their progesterone drops off faster than their estrogen. This causes stress, anxiety, problems with sleep, depression, irritability. Then at 50, at menopause, the difference is at its highest. But in time, the estrogen drops off. That speaks to why older women don't seem to have any hot flashes or hormone issues, because they're back in balance, but both very low. I'm going to talk about progesterone. For PMS, it may be all you need. It is helpful with depression, anxiety. Women and young women under stress suffer from pregnenolone steal, so they don't have enough progesterone. So many young women have significant PMS, depression, anxiety. Keep in mind that it is the pregnancy hormone, so there's no studies how it affects birth control. You'd want to use a non-hormone form of birth control. Pre- and postmenopausal, sometimes progesterone is enough. If the symptoms are anxiety, depression, irritability, weight gain, starting with progesterone may be all you need. This can be bought over the counter. It should be monitored. and I always feel it's better to work with a medical practitioner. But you can buy it over the counter. It has very good instructions, and you can start progesterone over the counter. Progesterone dosing. Oral, which is prescription, may help more with sleep. So if sleep is a problem and topical doesn't help enough, you may need to consider oral progesterone. That is usually best done compounded because you get a sustained release. The manufactured progesterone is immediate release. Be sure if you're using a pharmaceutical manufactured product that it says it's progesterone. That's the only way you know that it's natural hormone and bioidentical. If it says anything other than progesterone, as we discussed in part 1, it's a progestin and can increase heart attacks, stroke, and breast cancer. Prometrium is a manufactured natural progesterone and is progesterone. It's very expensive, and again, it is immediate release, which doesn't work as well for many women. You may need to add some progesterone cream in the morning if you have low progesterone symptoms during the day. You don't want to take oral progesterone during the day because it can make you too tired. Oral progesterone is most helpful with sleep. Progesterone cream. Again, it may not help you with your sleep, and if so, you need oral, but it does help with depression and anxiety. Sometimes women benefit from applying half the dose twice a day, a little in the morning and a little later in the afternoon. You can apply once a day if remembering to apply twice a day is too difficult. It is over the counter and relatively inexpensive, so around $22 for 3 months. What if you don't have a uterus and you've had a hysterectomy? Sometimes people hear they don't need progesterone. That is wrong. Yes, you need progesterone. Don't just take estrogen. Progesterone is a hormone, originally only used to prevent uterine cancer when women were on Premarin, the old horse urine estrogen. But you need to take progesterone if you're using estrogen. There's receptors all over the body, and it's for mood, depression, anxiety, and many other things. So if you are taking estrogen, you probably need some progesterone. Low progesterone can cause hot flashes, insomnia, anxiety, fibrocystic breast disease, water retention, fat and weight gain, low libido, brain fog, muscle aches, dry skin, dry eyes, hair loss or thinning, osteoporosis, osteopenia, and headaches. Estrogens. Which ones are bioidentical? We have 3 different estrogens in our body. They are estrone, estradiol, and estriol. Estriol is often added to topical estradiol creams because it's thought it might be breast protective. Estradiol is the most often substituted estrogen when you have low estrogen. That's because it has the most effect in the body. Topical estrogens are usually 50-50. 50% estriol, again, that's the very weakest estrogen, doesn't have much estrogen activity, but it is considered breast protective, and 50% estradiol. This roughly matches the balance in the body. Estriol can help repair tissue and is often used alone. It's in many face creams and is used as a vaginal tissue repair. You can also use Biest, which is the mix of 50-50, for vaginal tissue repair. Estrogen dosing. It is better to use topical estrogens and to use the lowest dose that will control your symptoms. Less is always better. The problem with oral estrogens is you need to take a larger dose because some of it is metabolized. So it doesn't all go into your system. But the active metabolites are a problem. And these metabolites are active and they are cancer causing. So you're taking a bigger dose if you take it orally and you're creating cancer causing metabolites. So topical is better. Vaginal estrogen can help with vaginal dryness and stress incontinence. So if you have leaking urine when you sneeze or cough or laugh, that can be helped by vaginal estrogen. Consider DIM, which is diindol methane. It's used to help direct the metabolism of estrogen to good estrogens. So if you are taking, especially if you're taking oral estrogen, which is not a good idea, you want to be sure and take estradiol to help direct the metabolites to safe metabolites. Testosterone, often necessary in menopausal women. Low testosterone can contribute to decreased sex drive, memory loss, low libido, bone loss, and muscle loss. Some people apply testosterone in the morning for energy or use in the evening for increased sex drive. You can also apply a small amount to your clitoris for sexual arousal. What you want to watch for is male patterned hair growth, so growth on your face, deepening voice, and any other signs that you might be getting too much testosterone. Sometimes women that are pelleted notice these symptoms. Hormone restoration, that's what you're trying to achieve. You only want the hormones that are necessary for you. It's easiest to correct progesterone first. You may also want to check your cortisol and thyroid levels. You want to use bioidentical estrogen at mid or low dosage range. And you never want to get progesterone or estrogen without progesterone. Too much and too little of a hormone may look the same, and different hormones can cause the same problem. So it's always good to measure your hormones. Adjust slowly, but adjust. So start low with a low dose, and you may need to increase your dose over time. Apply estrogen vaginally if you have vaginal dryness. You can use a troche, which is under the tongue. They don't always give the best results because sometimes they deliver too fast, so they dissolve under your tongue. Sometimes they taste bad. And if you swallow the hormones that are released and don't let it just absorb under your tongue, it will deactivate the hormones because they're deactivated when you take them orally. Oral is frequently not the best option, especially for estrogen, which has active metabolites. Testosterone is not absorbed orally, so topically is often the best. Can you put all your hormones together in the same cream? Initially, you may not want to put all the hormones in one applicator because you can't adjust one hormone at a time. But after your doses are stable, you can put them all together, and it is cheaper and much easier because you only apply one amount of cream and it has all your hormones in it. What to do first? You can test your cortisol and DHEAS and your hormones if you've not had them tested. You test cortisol 4 times in one day. You use the large tube first, which is unfortunate because you have no saliva in the morning. So it takes a while and maybe up to 30 minutes. You fill that large tube half full with saliva first thing in the morning. So within the first 30 minutes of getting up, you can't drink or eat before you fill this tube half full. It is the only one that takes time. The noon, evening, and night tubes fill very quickly. Cost about $140 to do the 4-point cortisol plus your DHEAS. If you haven't had your hormones tested, costs about $210 for everything, the 4-point cortisol, DHEAS, plus your hormones. Saliva testing is very accurate because it tests what's in your tissue, and it's been done for a long time. It's less invasive and very, very accurate. You'll want to use the 4 test tubes in a blood and saliva test. You can pick these tests up for free from Good Day Pharmacy. We carry them as a service to our customers. There's no charge to pick one up, so whenever it's convenient, you can pick one up and then do the test when you're ready. We carry the blood and saliva, but what you'll use for cortisol is just saliva and for your hormones. If you have any questions, you can call ZRT Labs or Good Day Pharmacy. You'll use all 4 vials in one day. Hormone labs, are they necessary? They are necessary to sort out all of the imbalances. Too much of one hormone can cause the same symptoms as too little. You don't ever want to have higher than natural levels because they can cause other risks. But you do want to treat symptoms and not labs. So if you have no low estrogen symptoms, but your estrogen is somewhat low, it doesn't mean you need estrogen. You're going to treat your symptoms. If you're still cycling, you need to know where you are in your cycle. You want to test your hormones when you're at day 19 through 21. So it's important to know if you're not cycling, you can test anytime. These are some labs that might help you become more balanced. I have on here your vitamin D. It is an important hormone for mood and overall health and immune system. Sometimes when you have hormones out of balance, your thyroid is also out of balance and can cause some of the symptoms. Again, if you're cycling, I have 18 to 21, but 19 to 21, 18 to 21, that's the time you want to test. If you have irregular cycles, test it after the next period, count out 19 days and test it. Menopausal can test anytime. If you're currently taking hormones, take the last dose at least 12 hours before your collection. But don't stop your hormones for more than about 12 hours. You don't want to stop for 2 or 3 days, or you won't be testing what your levels are on your current doses of hormones. So it's important to keep taking your hormones. Just be sure to take your last dose at least 12 hours prior to collection. I like the Topic Click applicator because not only does it measure out your hormones, but also you don't get it on your hands. Getting hormones on your hands is the easiest way to transfer it to children and pets or to your partner. If you use the top of the Click as your applicator, you twist the bottom, it comes out the small hole, then holding onto the applicator, you use the applicator to rub in the hormone. Balance is important. You have to get it right to feel well. So don't give up. Keep communicating because to get hormones right often takes adjustment. Adjust slowly and retake the hormone balance test. If you'd like an individual consultation, which can be very helpful because we review you, your health history, your symptoms, your hormone testing that we recommend, and then a follow-up appointment to review the tests and interpret them with you, and recommendations are written to your provider. So your provider will get a written list of recommendations, and so will you. How to schedule your consultation? If you call the pharmacy at 970-224-1212, our hormone consultant will contact you to schedule your appointment. The cost is $150, and it's a very extensive review. This is the end of part 2 of 2. Thank you, and I hope this has helped you understand your hormones and how we might be able to help.